My name is Timothy Ratich, and I'm a oral health officer at Beacon of Hope Hospital. So, with me here is the structure of a tooth, a healthy tooth. Yes, so a healthy tooth has the enamel, it has the dentine, it has a gum, it has a bone, and it also has the roots and nerve tissues inside the tooth. So, this is a healthy tooth. But now I want us to talk about the conditions which usually affects our teeth and our oral cavity. 1. Gingivitis. So what is gingivitis? Gingivitis is the inflammation of the gingiva. This is a gingiva. Gingiva is also called the gum. So the gum can be inflamed, and this could be actually caused by so many issues. For instance, poor oral hygiene. Poor oral hygiene, if you don't brush your teeth regularly, you're very likely to get gingivitis. And so what are some of the signs of gingivitis? You find a person who has gingivitis has bleeding gums. Every time you brush your teeth, you find that blood is oozing from your gums. That's a sign of gingivitis. Another one is swollen gums. You find that your gums are swollen and the color of the gums have actually changed. The normal colors of the gingiva should be coral pink, but when you have gingivitis, the color can change to red. That's a sign of gingivitis. Okay? So the other condition I'm going to discuss with you this day is periodontal diseases. So periodontal diseases, this is a progression of the gum disease of gingivitis. If gingivitis is not treated on time, it will progress, it will advance to something called periodontitis. So periodontitis now, this is the inflammation of the periodontium. Periodontium is the supporting structures of the teeth. So what are these supporting structures of the teeth? 1. This bone. This is called alveolar bone. Okay? And so here, in this tooth here, there is some fibers which actually attaches the teeth and the bone. So when these supporting structures of the teeth are affected, now that is called periodontitis. Okay? So what are some of the signs of periodontitis? 1. There is deep pockets. Usually your teeth should be attached to the gum very tightly. It should be tight. There should be no pockets here. But now if you have periodontitis, these pockets will open up and there will be pockets here. Alright? The second one, there is something called bad breath. If you have periodontitis, you will have bad breath because there is a lot of bacteria in your mouth, and so now you will start having a bad breath coming from your mouth. Another one, there is loss of bone. This bone which supports the tooth. If you have periodontitis, with time this bone will get destroyed and you will lose this bone. And what will happen finally? You will have to lose the teeth. Because of what? The supporting structures of the teeth have been lost. This bone is lost. This gingiva is highly inflamed. It gets damaged. The supporting fibers which are here, called Chavez fibers, they get broken, and so this tooth will start shaking. You will start shaking your teeth yourself, and then with time, this teeth will start falling down. So you'll start having your teeth falling down and you lose your teeth. The other condition I'm going to discuss is dental caries. So what's dental caries? Dental caries, this is the progressive demineralization of the teeth. Your teeth usually has calcium and phosphates in the teeth. But now, if you eat some sugars and you don't brush your teeth on time, then these sugars will ferment. There is some bacteria in the mouth which usually ferments these sugars to form acids called lactic acid. So this lactic acid will now start digesting, removing the minerals from your tooth and creating some cavities in your teeth. So when these cavities starts progressing, it starts very slowly from the enamel, and then it progresses slowly to the dentine, and then finally to the pulp. So at times we have these dental caries, but we don't know that we have a problem in our teeth. So it's very important for you to visit the dentist anytime you start seeing that there is a small cavity in your teeth. It can be restored through fillings. How do you know that you have dental caries? You will have cavities in your teeth. If you start seeing cavities in your teeth, that means you have dental caries. If you start having pain in your teeth, severe pain or could be also mild, that's a sign of dental caries. You could also have bad breath. That's a sign of dental caries. So dental caries is actually the #1 cause of teeth loss all over the world. Every day a person loses a tooth in the world because of dental caries. So this is a very serious concern. You should visit your dentist for proper medication for that. The other condition I'm going to discuss is sensitivity of teeth. Teeth sensitivity. This is a very common condition which affects so many people. And so what causes this sensitivity? Dentine hypersensitivity occurs when the dentine becomes exposed. This is the dentine. So when this dentine now gets exposed, that is probably through dental caries. When this is exposed, now the nerves are very near to the dentine. So you start experiencing some sensitivity. Another cause could be also the recession of the gingiva. Yes, this is the gingiva or the gum. If you brush your teeth irregularly, or if you don't brush your teeth properly, you could expose, this is called cementum. That's the root of the tooth. Now, if this cementum is exposed, you see it here, if it's exposed, you'll have sensitivity because this area is quite sensitive, unlike the enamel. Okay? So what are some of the signs of sensitive teeth? 1, there is sudden sharp pain. This sharp pain usually occurs when you take very cold or hot drinks or even food. So that's a sign that you have sensitivity. Cold air also, when you breathe or when you want to talk with your friend or when you laugh, you start having sensitivity in your teeth. That's also a sign that you have sensitive teeth. And so this one can be prevented if you brush your teeth properly. Okay? Another condition which I'm going to discuss, which is very common, is stains in the teeth. So usually the teeth are supposed to be white, like this one here. It's a very beautiful white teeth. But you find that a person could have been having very white teeth when they were younger, and then with time the teeth starts turning color. So there are two types of teeth coloration. There is one called extrinsic stains. These are stains which are outside the teeth. These are usually probably caused by foodstuffs we take. For instance, if you take Coca-Cola and you don't brush your teeth on time, that black substance in the Coke could actually stain your teeth. The other coloration of the teeth is called intrinsic, which is inside the tooth. This is, for example, when a person lives in a place where there is excessive salt in the water they take. Okay, that's something called fluorosis. So fluorosis is very common. Let's say, for instance, people in Rongai, they experience, in Nakuru, in Baringo, they have a lot of fluorosis. So fluorosis affects the teeth. You start seeing coloration of the teeth, and even the teeth could get damaged because of fluorosis. So you need to visit your dentist to make sure that your teeth are checked, they know the cause of the stains in your teeth, and then you'll get proper medication. I'll highly advise everybody is watching this to visit Beacon of Hope Hospital for proper diagnosis and treatment of all your oral health conditions. You're highly welcome, and thank you.